Before we get started with our patient's retaping, we want to make sure that we decrease any distractions that are in the room. This is a new practice to the NICU, so be sure to pay attention closely. Before you get started, put the stop sign up outside of your patient's door and close the door until it's open just a crack. This will help to decrease the noise from the outside in the hallway, and it will also alert other staff members that you're in here doing a procedure that requires your full concentration. If in the event the patient does not do well and we need additional help, the person who's watching the monitor can either hit the code button or staff assist, or they can be the one to open the door and yell out for additional assistance. Another thing that you can do to help decrease distractions is to prep the family for what is about to occur. By answering their questions and explaining the procedure that we are going to do beforehand, there will be a decreased likelihood of them asking questions during the retaping or coming up to the bedside to see what we're doing, and which can also cause distraction. All right, now let's get started with our retaping process.
Hi everyone, so we're getting ready to retape an ET tube. This would be done if we were taping initially, if an ET tube's been placed, if we have to replace our tape because we have to make any adjustments in the ET tube, or if it's due to retape based on the device we're using. So currently we are talking about tape. This particular tape is good for 72 hours or to change as PRN. Things that you would change PRN would be if it was starting to peel up, if they had slobbered on it, or if they had thrown up a bunch on it, then we should change that tape out so that they have good, clean, secure tape. Always remember, change both pieces of tape every time, and don't reinforce it on the skin, because that can potentially lead to an unplanned extubation later, which we have had instances of in our unit. So before we take off the tape with this patient, we're going to prep a few things first. One, we are going to have something to wipe the face off with just clean water or water and soap. Please don't use alcohol, because that can destroy the properties in the hydrocolloid that's in the duoderm, as well as in the Neobar. And it prevents your tape from sticking as well. And then making sure it's dry. We want to pre-cut our two pieces of tape. And when you're measuring tape, you want to make sure that you have enough to go from the middle of one cheek all the way to the tragus on the other side. So that's where we're going to measure, and measure two of those. And then we're going to cut it into an E shape like you see here, leaving a fairly good chunk at one end to stay connected to the chin or the cheek. And then the other will go across the upper lip, the lower lip, and around the ET tube. You will also want to cut new duoderm, and that's to help protect the skin, prevent any breakdown from happening there as well. And then you want to make sure that you have your team ready. Remember, at a minimum, we need at least 3 people in the room during an ET tube retaping. That includes Megan, who is going to be our airway guardian, myself, who will be the taper, and Lindsay, who's going to be the monitor watcher. So Lindsay's role as a monitor watcher is to stop if there are any concerns with the patient, letting us know, like if we need to be suctioned, to go ahead and give O2 breaths if needed, that part of it. And also to redirect my eyes as well as Megan's if we look away from the ET tube from where we are supposed to be taping at, just so that we always have a good eye on where that tube is at. Megan's role as the airway guardian is to protect that ET tube and always make sure that it is taped where it is supposed to be taped at and it doesn't slide in or out during the retaping. And then as the taper, I will be responsible for taking off all the old tape and putting new tape on. So once you take off the old tape, you're going to take one piece off at a time, slowly pull that away. As soon as you get that last piece of tape off, make sure you let the airway guardian know that you are free, and that they are solely responsible for that ET tube. As you can see, Megan has her finger in the patient's mouth with her finger on that ET tube, holding it up against the gums and the palate, and that will keep that tube secure. With tape, we're always going to flip side to side. So if we were taped on the right side, we're going to switch over to the left and vice versa every time we do a retaping. So once we have that tape off, I'm going to clean the face, like I said, make sure it's dry, and then I'm going to put these little pieces of duoderm on to protect the skin. And Megan, where are we taped at?
We are currently secured at the 11 at the gum.
Perfect. So I'll put my duoderm on.
How's the baby doing, Lindsay?
Doing great. I love that.
And then I will get ready to put my tape on. The easiest way I've found to do this is to kind of tear the paper backing but not take this paper off. And that will make it easier for you to get those strips going when you're starting. And then I'm gonna pull off this thicker piece, and we're gonna tape here on the left side in the left corner. So I'm gonna get as close to the corner of the mouth as I possibly can get with this first piece without going into the corner.
That looks great.
Once I have that down, I'm gonna put my top piece over the top lip, being careful not to cover the nares and not to go over the lip itself. This bottom piece, I'm then gonna go along the lower lip. Again, making sure to not cover their lip at all.
Okay.
And then this middle piece, we're gonna get it right up next to the corner of the mouth.
Bring it over to the side there. We're still secured at the 11 at the gum.
Okay.
Okay.
I'm gonna do one piece perpendicular, and you can see Megan still has her finger in the mouth, holding that tube tight up against the roof, while I do my first piece perpendicular to the ET tube, and I want to get it around at least once without putting too much pressure that I'm pushing down into the cheek or the gum. And then I can start moving up the ET tube so that I'm getting more surface area to have that tube be secure. When I get to the end of my tape, I'm going to leave a little tab so that when I go to take it off the next time, it comes off pretty easily. And then I'm going to do the same thing again with my second piece of tape. I'm going to take the wider part off. Again, try and get as close to that ET tube in the corner of their mouth as you can. And again, I'm going on the same side that I started with on the other one. You're going to do your top piece across the top lip, the bottom across the bottom. And now this time with this piece of tape, this middle piece, I'm gonna wrap the other way around. So if I wrapped counterclockwise the first time, I'm gonna wrap clockwise the second time. So again, I wanna get that first piece perpendicular and pretty tight, but not so tight that you can't suction through it. And I'm gonna have Megan check one more time that we are at 11.
We're at 11 at the gum.
And then I'm gonna wrap that tape up the tube, leaving a tab at the end. And there you have ET tube taping using tape. Hey everyone, so we are getting ready to retape for a Neobar. So we wanted to kind of talk through that process with you guys as well and just give a few quick little reminders. So the biggest thing with the Neobar is that all the Neobars come with this little tape measure, and that's how you measure for proper proper Neobar size. And even on the tape measure itself, it says start at your midline and then measure backwards to the opening of the ear canal. And so if I were to measure her, and I start this in the center of her septum and go back, she would actually be between a green and a blue on this particular tape measure. And so I would bring both to the bedside and make sure which one fits. Now, Megan and I did that earlier, and we found out that actually neither of those fit, and she needed a smaller size Neobar just to be able to fit on her face because she's so petite in the face. So always just do that double check before you get in the middle of your retaping. In addition to that, you're gonna want something to clean their face with. Again, either just plain soap or soap and water. Have your Neobar ready to go. And this is something that the monitor watcher, who in this particular case is gonna be Lindsay, she can also hold on to for us to warm these tabs up to make sure that they stick to the skin. They are heat activated. The other thing with these smaller Neobars is sometimes they tend to stick out a little bit from the face and they don't have a lot of flexibility. So you can flex these at this joint and that will help it sit a little bit closer to the face as well. So I'm gonna give that to Lindsay while we get everything else ready to go. So just like any type of retaping for an ET tube, you want to have 3 people involved at minimum. So for today, I'm going to be the taper. Megan's going to be the airway guardian, so she's going to have good hold on that tube, and Lindsay's going to be the monitor watcher while she's warming up my Neobar as well. So I would take off the tape around the Neobar itself and the ET tube, and then slowly peel off that Neobar, protecting their skin. You just want to make sure anytime you do any adjustments with this ET tube tape that you always use a new piece of tape. It cannot be reused as it loses its adhesiveness. In addition to that, when you are prepping their skin, make sure you don't use any alcohol, because again, that will destroy the hydrocolloid in the Neobar itself, and then it won't stick to the face as well. And just as a reminder, Neobars are due to be changed every 5 days, or PRN. And so we can change those as needed. So after I got all the tape off, and we said we were at 6 at the gums.
6 at the gums.
Okay,
Like
so
we're still there.
Megan's gonna hold that tube secure. Again, you can see her fingers are in there holding that tube up against the gum and the soft palate. While I was taking off all of this tape, Lindsay had warmed my Neobar up, and so it's ready to go. When you put your Neobar on, I'm gonna start on this side. You wanna get back as far as you can on the face so that this Neobar is right up next to the ear on the most bony part, so it doesn't move around a lot. And then you wanna do the same on the other side, getting back as far as you can. And you wanna make sure that this platform of the Neobar is center. Once you do that, you wanna sit here and hold this Neobar onto the face for a minimum of 30 to 60 seconds. And again, that heat's gonna help activate it and make it stick to the skin. Once you've done that, if you haven't done it already, you can put your tape on the platform of the Neobar, and you can always have this done ahead of time as well. You wanna make sure that you wrap at least 1 full time around the platform, just to make sure it doesn't come undone. And then before we secure that ET tube to it, Megan's gonna make sure that we're still at 6.
We're still at 6 at the gum.
I'm gonna hold that ET tube tight up against the platform.
Vital signs are stable.
Thanks,
Perfect.
Lindsay.
Making sure that we're still in good position. And then I'm gonna wrap up this tube as much as I can while I keep this tape on the platform. And that's just to increase the surface area to make sure that it stays secure. And then tap my tube over,
Okay.
make sure it's secure. We'll check one more time that we're in a good position.
Yes, we are.
And then we're done with retaping a Neobar.